So I would like to ask you that you've been working in the public health space for years now. 75 years, India has achieved a lot when we talk about healthcare. What do you think has been India's biggest achievement according to you?
Yeah. As a public health person, I must tell you that when we became independent, and before starting, I must remember Gandhiji's contribution not only to our independence, but his wisdom about health. What he said is gold and silver are not the real wealth of the nation, but health is the real wealth of the nation. So he also recognized that. What I think, as we became independent, the British had created a health system which was to deliver health to their armed forces. So that is why there were military hospitals in big cities and there were civil hospitals, some, to the British and Indian servants of the British Raj to get treatment. But there was no health system almost in rural areas of India. So the first thing, and of course it was British officer, Sir Joseph Hoare, who was commissioned to survey what is needed for rural India. And after independence, the whole primary health care system which we created with more than 25,000 health centers, which is one for 30,000 across India, more than 150 sub-centers with nurse midwives and now community health officers, one for each 5 villages. And now very recently under National Rural Health Mission, the ASHA workers and community health officers. So today we have the foot soldier of the health system in each village, which is unimaginable when we were becoming independent. So I would say as a public health person, this is one of the main game changers. And all countries who changed their health system did it. China did it in the 70s through their barefoot doctors. Malaysia, Brazil and other big countries, diverse countries created a workforce, because a villager who lives in a village of 500 or 1,000 is 20 kilometers away from an MBBS doctor, is 50 or 100 kilometers from a specialist, and maybe 200 kilometers from a district hospital. So if he falls sick at night or has a difficult delivery, some woman, who is the person? So that is the first game changer, I would say, that expansion of our rural health services. Of course, we need to do more, but it is, and we saw how our ASHAs, ANMs, medical officers, other laboratory technicians worked in the rural areas and prevented COVID and as well as provided the care. Second, if you want to count the successes of public health, was smallpox eradication, which happened in 1977, started through vaccination programs 200 years ago by the discovery of vaccine against smallpox by Edward Jenner in Britain, and later on through WHO and other international efforts, we eradicated smallpox. Not only vaccination was available for 200 years, but surveillance, where it is happening, how it is getting transmitted, how can we stop the transmission, ring vaccination, and we throughout the world removed smallpox, which is a major curse in public health and infectious disease. Similarly, polio eradication, immunization program, the child health improvement. At the time of independence, almost 150 to 200 children were dying in the first year of life after birth, as compared to now less than 30. Maternal mortality, delivery, it is not a disease. Delivery is not a disease. It is a normal physiological process. But the estimates of mothers dying in delivery was almost 1,000 to 2,000 mothers dying per lakh of deliveries, 100,000 deliveries. So 1% mothers were dying just in the process of delivery. We have reduced that to less than 100. So these are some of the big achievements and game changers. Of course, we can discuss more, but I don't want to take up all the time. But we can further think of what we can do and what we have also achieved.
So like Suchitra ji just said, Dr. Mavalankar, I would like to ask you here, we've understood the importance of vaccination especially for children, and we have made there's been a significant improvement when we talk about immunization, but unfortunately only 65% of children in India have received full immunization during the first years of their life, which is very critical. Dr. Mavalankar, when we talk about achieving the SDG goals, the Sustainable Development Goals, tell us how can we achieve this and make it 100%, because immunization is key for every child.
Yeah, I think very important, because immunization, the making of vaccine is the starting of the story, but reaching this vaccine to each child throughout the India through 5 lakh villages and many more settlements is a logistical, I should not say nightmare, but a major exercise. And of course, we are good at it. We have delivered these vaccines in the COVID times, but as happens, when emergency is there, we are ready to fight. When the war is there, everything is galvanized. But in routine vaccination or routine health programs, sometimes we slack off. Plus, the community also has to have continuous lessons by Amitabh Bachchan ji and many more, that vaccination is life-saving. Not only polio, but he said about hepatitis, and now there are many more vaccinations, because preventive activities, you don't see the result immediately. आपके पेट में दर्द है, आप डॉक्टर के पास जाते हैं, वो दवाई देता है, ठीक हो जाता है, डॉक्टर भगवान है. बट जो ANM नर्स, आपका बच्चा खेलता है, कूदता है, उसको कुछ नहीं हुआ है, उसको आगे में न होने के लिए हम इंजेक्शन देते हैं, बच्चा रोने लगता है, एक दिन उसको तकलीफ होती है, तो माँ बोलती है कि ये क्या है. So we have not been able to sell our public health, because our public health cadre is very weak. You might be surprised that we don't have a national public health cadre. Our nation also doesn't understand what is public health. They think it is doctor's job. Public health is a multidisciplinary cadre. We need health educators, we need actors, we need lawyers. Our public health laws are the ones which Britishers gave us. So we need a long walk on this path to strengthen our public health system. So if we strengthen our public health system, including communication, because finally it is a voluntary acceptance of the vaccine by each family, each mother, father, father-in-law, mother-in-law, grandmother, that will allow each child to be given vaccine. We have the logistic systems almost. The workers are going, but if people refuse, they cannot be forced. So we have to have the equal amount of educational effort which we put in polio, then we will reach everywhere. And if you take the example of family planning, we were really Vishwa Guru, the first government to start any government family planning program in 1952. No other government, not even America, England, had family planning government program. We were the Vishwa Guru. That time, there were 6, 7 children being born to each woman. Now there are less than 2 children. That is an untold success story, as is the vaccination. And if more children die, families want more children. So the vaccination and child survival helped our family planning program. Lastly, I want to emphasize that another untold Vishwa Guru story is one of the very early and very transformational liberalization of abortion as a women's right almost issue. We liberalized abortion services in 1971, 1 year before Sweden did. So in abortion, we were 1 year before Sweden. So in some sense, in many public health areas, we have been the torch bearers of global change. Even in tobacco, smoking, you might be surprised. We always see China is always better than India. But smoking control, India is much better than China. China has much worse record than, but nobody knows, nobody talks. If you see Indian tobacco packet, it has a big warning with a pictorial warning, whereas Chinese packets don't have.